everyone, I'm Brenna Kelly and this is my portfolio presentation, and we will be discussing the lack of better mental health resources in the Omaha area. I chose this topic for a variety of reasons. I come from a military-focused family and have had the honor of forming close relationships with current active duty and veteran personnel. I have seen firsthand the impact that mental health can have on these men and women. It is truly a debilitating disease that needs to be on the forefront of medical professionals' agenda. My personal connection to this issue centers around the relationships I have formed throughout the past few years. My brother is currently serving in the United States Marine Corps, and my boyfriend recently completed his 4 years of service in the United States Marine Corps. Due to the relationships I have with both of these individuals, I've had many opportunities to meet other service members as well, male and female. And most of them struggle with their mental health. This is largely due to being away from their home states, family, and friends, but it is also due to the stress of serving our country, the leadership it lacks, and the extreme lack of emphasis that is being placed on veteran mental health. I have gotten to witness the difficulties that come with post-deployment and post-enlistment. These men and women struggle with varying levels of PTSD, reintegration issues, and face numerous barriers when re-entering the civilian populations. I have grown a passion for mental health, especially when dealing with the mental health of our military forces. Doing what I can to help these individuals and the hundreds of thousands of other veterans within the United States means the world to me. Just a little background on the public issue. As the 20-year war in Afghanistan is coming to an end for the United States, focus is being placed on veteran recovery and mental health resources more now than ever. Today, the current access to appropriate mental health services for veterans returning to the United States mirrors that of the mental health availability for the general population. There are drastic shortcomings when dealing with mental health services on a global spectrum. The most publicized issues for those who have served are PTSD and depression. Other issues such as suicide, traumatic brain injuries, substance abuse, interpersonal violence, anxiety, and the reintegration into civilian society are also included. Yet, the current access to these services is extremely limited. So, what can we do? The overall goal is to increase the availability of crisis intervention and adequate mental health services for all veterans who have served this nation. This can be done by implementing new standards of care, decreasing the stigma surrounding mental health, working with healthcare professionals, and more. An effective communicator, as defined by Nebraska Methodist College, is an individual who uses critical thinking to generate, connect, and organize ideas in a written, oral, or nonverbal manner. As a full-time college student and part-time in-home caregiver, ensuring that effective communication is being used between my classmates, coworkers, patients, and myself is vital. When thinking about effective communicators in my journey to becoming one, the most impactful experience that allowed me to grow occurred during COM 245, Language and Culture in Healthcare. It's also known as American Sign Language. Upon being enrolled in American Sign Language, I was taught simple vocabulary, rules regarding the deaf community, and how to effectively communicate using a more nonverbal approach. One morning during clinical, I was assigned to a deaf patient who was clearly in distress about being hospitalized. She wouldn't eat her food, she couldn't communicate with the staff, and was extremely uncomfortable. Feeling confident in my capabilities, I entered her room and signed, "Hi, my name is Brenna, and I am your student nurse. How can I help you?" When I finished signing, I could physically see the uneasiness leave her body. With basic sign language and a foundation in understanding what an educated citizen is, I was able to grow as an effective communicator. This process helped me to become an effective communicator because I learned that using proper hand gestures, facial expressions, and body language are vital to the effectiveness of signs being communicated to the other party. I also learned that effective communication consists of a deeper meaning of connecting with other individuals by using a mode of communication, such as sign language, to further expand one's knowledge of the patient's culture or way of life in general. When working in the healthcare field, understanding that communication oftentimes comes with barriers and limitations has allowed me to reduce the amount of healthcare inequities that some individuals face. When correlating this with the veteran populations, it is important to note that 31.1% of veterans identify with a racial minority group such as African American, Asian, American Indian, or Alaskan Native. Going further, 15.5% of these individuals do not consider English their primary language. When caring for those of the veteran community, being a culturally competent individual who can effectively communicate in a written, oral, or nonverbal manner can greatly impact the level of care they receive. It was during the third week of Nursing 240 Clinical when I was assigned to a laboring mother expecting a baby girl with a cleft palate. In the beginning, the laboring process was going smoothly, and the room had the same usual excited aura to it. Once the unborn baby began to show late decelerations on the fetal monitoring script, we knew that she needed critical nursing interventions. With fast action by the nurses, the baby was born safely and the mother began to steadily recover. However, things took a turn for the worst when the newborn became hypoxic. Due to the cleft palate, the newborn's tongue was blocking her airway. Expecting this, the NICU team whisked her away while the father followed intently behind. Recovering herself, the mother was unable to follow her baby into the NICU and was left with little information regarding the status of her daughter. Feeling for the mother, I spent the next few hours transitioning between the NICU and postpartum area to provide medical information regarding the infant. This required effective communication between the NICU, nursing staff, and myself. It became clear that I was a developing effective communicator as I was transmitting critical information between the nursing staff and patient. I found myself utilizing critical thinking skills when learning about the newborn's condition, and I realized how crucial it was to soak in the information correctly and present it to the mother in an accurate and beneficial manner. In doing so, I became more comfortable with communicating in an effective way. This was possible by trusting myself, trusting in the knowledge I have gained throughout nursing school, and collaborating with numerous levels of healthcare professionals. Relating this to my public issue, it is important to note that veterans often exit the service with an array of physical and mental disabilities. It can quickly become confusing and difficult to understand for these individuals. Ensuring that I transmit critical information regarding the care of veterans in a correct manner will help to decrease the confusion, medical inadequacies when caring for the veteran populations, and the inadequacies when working with the mental health of veterans. According to Nebraska Methodist College, a reflective individual routinely engages in habits of inquiry that influence ways of thinking and actions. It was during my freshman year course, Nursing 101, that I was exposed to the clinical responsibilities that would soon be considered my full-time occupation. I was full of anticipation, nerves, and fear. I did not know what to expect and did not want to disappoint myself, my classmates, or the nursing staff I was working with. It gave me a new perspective and taught me how to reflect on my own feelings of stress and anxiety while working with patients for the first time. It became apparent that I am a developing reflective individual because I consistently used my critical thinking skills when caring for patients. For example, I thoroughly explained what the action of the drug was and the nursing considerations that went along with it. I also took responsibility for my actions and emotions. When I was feeling anxious or stressed, I let a classmate know right away. Feeling the same way, they were often able to relate to my feelings and provide helpful advice. This experience will help to shape me into a better healthcare professional. When working as a nurse, I will be in many situations where my feelings need to be portrayed in a mature and self-recognizing manner. I learned that embracing my emotions, reflecting on the past, and moving forward in a positive way will help me to give the best quality of care possible. Relating this to my issue, many veterans today are fearful to reach out for care due to the possibility of judgment. For example, a study by the Substance Abuse and Mental Health Services Administration revealed that a mere 50% of returning veterans seek mental health services. This is due to personal embarrassment, long wait times, shame, fear, lack of understanding, logistical problems, and demographic barriers. Ensuring that healthcare professionals utilize essential characteristics such as empathy, respect, and self-recognition of personal thoughts and emotions can help veterans feel more comfortable when reaching out for necessary medical care. Moving forward, a specific example of how I embodied the meaning of a reflective individual also occurred during my sophomore year medical surgical class, Nursing 210. My classmates and I were assigned to read the novel Being Mortal by Dr. Atul Gawande. To my surprise, this novel openly discussed subjects that are often swept under the rug to maintain the veil of comfort that blindly covers most of the population. Such topics Atul included was the concept of death, the unknowns of aging, and the personal depictions surrounding the importance of providing top-notch care during the final moments. Atul discussed how the death and dying process is often overstepped and underappreciated, meaning medical professionals are frequently less knowledgeable about the death and dying process, which causes a barrier between the patient, the healthcare professional, and the desired outcome. Through Atul's collection of stories and experiences, he was able to provide me with a new perspective. I learned that I am a reflective individual because while reading the novel, I consistently found myself analyzing my personal views of religion and the afterlife. I also took personal responsibility by admitting that I lacked the proper knowledge about the death and dying process. Lastly, I gained a new perspective on older adults, the dying process, and the importance of normalizing the death process. I was given a new perspective that will allow me to be a better, more well-rounded caregiver. When relating the concept of death and dying to the mental health of veterans, the Nebraska Veteran Suicide Data Sheet listed a total of 46 veteran suicides. A large factor associated with this data is the lack of access to quality mental health services after spending time in the military or returning to the United States following a deployment. Without proper guidance, an overwhelming sense of suicidal behavior, especially in the younger generations, is common. Taking adequate measures to understand the death and dying process will help me to provide better nursing care and increase my knowledge surrounding those who are experiencing suicidal thoughts and tendencies. According to Nebraska Methodist College, a change agent uses the disciplines of the liberal arts and sciences to analyze historical and contemporary situations and systems, to develop cultural competence, and to take appropriate initiative to effect change. During my clinical rotation at the Omaha VA Medical Center, I was assigned to a patient that was extremely hesitant to bear weight on his injured extremity without the use of an assistive device. When a doctor entered the room, he instructed the patient to walk down the hall without using his walker. In most cases, this would be fine. However, as I mentioned, before the doctor came into my room, the patient had told me that he has not walked unassisted in years and feels uncomfortable ambulating without the walker. I very calmly discussed the situation with the doctor, and he refused to listen. At this point, it was clear to me that the doctor was treating my patient more as an experiment than a human being. Knowing my patient was not comfortable with the situation, I asked the primary nurse to aid in the conversation. The nurse agreed with me and told the doctor that the patient would be using his walker and it was not his place to take away an item of safety from a patient. Being a second-year nursing student, I was proud of myself for standing up for my patient and ensuring his safety over all else. I learned that having respect for patients as people and not just patients is a key component to their health and treatment. Nobody wants to be treated like an experiment. All patients deserve utter care and compassion from all healthcare physicians. Something that I have held on to, especially during the past few years, is that not one person knows somebody's full story. You don't know what the patient has been through. You don't know how much fight they have left. So giving your all during the hardest time of their lives can make a huge difference. Oftentimes, mental health resources become a huge barrier for veteran personnel. This is due to fear, embarrassment, and the hesitancy to reach out for help. They feel inferior compared to others and are oftentimes looked at as an experiment for doctors and other medical professionals. With a massive lack of clinical understanding surrounding the difficulties veterans face, they are left without proper treatment. Treating these men and women with utter respect and diligent care will help to increase the awareness surrounding veteran mental health. Moving forward, it was during the course Nursing 450 that I had the opportunity to observe a mitral valve replacement at Methodist Main Hospital. I've seen numerous operations throughout my 4 years in nursing school. However, I was not aware of how intense and rigorous this procedure was. When speaking with the patient prior to the procedure, he was extremely anxious. He pleaded with me to ensure that his wife was kept updated. Although I was just a nursing student observing the operation, ensuring to fulfill the patient's request was pertinent to me. This experience will greatly benefit me as a future healthcare professional. I learned that taking the opportunity to use my voice and nursing skills to benefit the patient is the true meaning of nursing care. In today's world, it is critical to understand that other people may have emotions and feelings about things that are different to yours. Being an advocate who fights for patients' wishes, concerns, and worries will dramatically alter the kind of nursing care you give. I truly think this was a pivotal moment for me going into my final months of nursing school. Oftentimes, I and other healthcare professionals forget how intimidating being in the hospital can be for patients. We also tend to forget the array of emotions a client may be experiencing. From fear to anxiety, this correlates well with the veteran populations. Taking adequate time to discuss these feelings will help veteran patients to feel more comfortable when reaching out for the care they need. In conclusion, when finding the correlation between the educated citizen and the lack of veteran mental health resources in the Omaha area, it is abundantly clear that competent nursing care is a vital factor in increasing adequate mental health services. And demonstrating what it means to be an effective communicator, change agent, and reflective individual will open the door to creating change over a desired topic such as the lack of mental health for veterans. It will also help to improve my own nursing skills, patient outcomes, and patient satisfaction. Creating this change for veterans requires intricate parts of each educated citizen forum. And here are my references. Thank you.